Understanding Transitional Cell Carcinoma, TCC, of the kidney. What exactly is transitional cell carcinoma of the kidney? It is a type of cancer that starts in the transitional cells lining the renal pelvis, which is the part of the kidney where urine collects. It can also affect the ureters, the tubes that carry urine from the kidneys to the bladder. These transitional cells are special because they can stretch and bend without breaking, which is important for normal urinary function. When these cells become cancerous, it is often called upper tract urothelial carcinoma. TCC of the kidney is not very common. In fact, it makes up about 10% of all transitional cell cancers, which are more often found in the bladder. It is crucial to tell TCC apart from the more frequent renal cell carcinoma. This is because TCC comes from the lining of the urinary tract, while renal cell carcinoma arises from the kidney's filtering tissue. In the early stages, TCC may not show any symptoms. However, as the cancer grows, some signs may appear. You might notice blood in your urine, which can be visible or found during tests. Persistent pain in your back or side that doesn't go away is another possible symptom. You could also feel extreme tiredness, experience unexplained weight loss, or have painful and frequent urination. Cramps in your side or back can occur too. Since these symptoms can be caused by other issues, it is important to see a doctor for a proper diagnosis. Certain factors can increase the risk of developing TCC of the kidney. Smoking is a major contributor, as it can damage the DNA in transitional cells. Exposure to specific industrial chemicals and dyes used in making plastics, rubber, and printed materials is another risk. If you have a history of bladder cancer, you may also be at higher risk because urothelial cancers can happen in different parts of the urinary tract. Genetic conditions like Lynch syndrome can increase cancer risk as well. Additionally, past use of the painkiller phenacetin, which is no longer available, has been linked to kidney damage and TCC. To diagnose TCC, doctors typically use urine tests to look for cancer cells. Imaging studies like CORT scans help visualize any tumors, and sometimes a biopsy is needed. Staging the cancer is important to see if it is localized to the kidney or if it has spread to nearby tissues or distant organs. Treatment options vary based on the stage and location of the cancer. They may include surgery to remove the affected kidney and ureter, chemotherapy, and radiation therapy. Early-stage cancers usually have a better outlook, while more advanced disease may require more extensive treatment. Regular follow-up care is important because there is a risk of recurrence in the urinary tract. From the perspective of kidney health, understanding TCC is crucial since it affects the upper urinary tract and can impact kidney function. Recognizing symptoms and risk factors early can lead to better outcomes. Preventive measures, like avoiding smoking and limiting exposure to harmful chemicals, can help reduce the risk of developing TCC. In summary, transitional cell carcinoma of the kidney starts from the lining cells of the renal pelvis and ureters. It can present symptoms like blood in the urine and back pain, and is associated with risk factors such as smoking and chemical exposure. Diagnosis involves imaging and tests, while treatment is tailored to the cancer stage. Early detection and treatment are essential for preserving kidney health and improving survival rates. Always consult a healthcare professional for personalized medical advice.